As we come to the end of the month, I am pleased to share a roundup of stories from across the Trust. We started the month by learning more about the Excel programme, a major transformation initiative designed to enhance urgent and emergency care here at Bradford Royal Infirmary.
The programme initially was thought we're going to make some improvements in A&E to reduce long waits. However, it's come to light that we are going to be minimum of 3 years. It's a very ambitious programme, and this is small steps to big changes.
The feedback that's come through from the patient experience mirrors what the staff are experiencing as well. We try to fix this just within the hospital. It feels like we're putting band-aids over the problem. If we can do some work with our system partners to make sure those patients navigate to the right place first time, there's an opportunity there to work with our ambulance service, local authority, primary care teams including GPs, we've got the voluntary sector involved, and we've also got some really key figures within the community that want to be a part of this piece of work. They're incredibly excited about understanding the narrative that's come from these feedback sessions, but collectively, how can we work together and co-design pieces of work that will be able to address those issues?
Thank you, Tanya, Wakas and Jeremy. We also heard about Bradford Hospital Charity's new exciting fundraising initiative to create a home-from-home environment for families with babies in the Neonatal Unit at Bradford Royal Infirmary. The charity is working in partnership with the Sick Children's Trust to raise around £3 million to build this new facility.
I think being able to have a home-from-home environment that you can remove yourself from that situation, but know that you haven't removed yourself from your baby is so vitally important.
On average, a family who's got a baby on a neonatal unit will spend an extra £405 a week on extra things like travel, parking, food.
So the home-from-home unit will remedy that and enable somebody to stay so close to their baby at a very, very challenging time.
This is above and beyond NHS budget, so it's not something that the NHS would necessarily pay for, which is why Bradford Hospitals Charity has got involved.
We are launching a Buy a Brick campaign in January alongside our partner, the Sick Children's Trust, and we're really excited about the campaign. It will be a visual representation for bricks over a certain amount in the entrance to the Women and Newborns unit.
Anything that people can do to support our project will inevitably reduce the stress and anxiety for families.
A home from home would mean that I enjoy every precious little moment that I have with my baby that I otherwise wouldn't have the opportunity to.
We need the help. We need people's support.
Thank you to everyone involved. On the podcast this month, we heard from Dr. Dinesh Saralaya, Consultant Respiratory Physician, about how we can all stay strong and healthy this winter.
Vaccination protects and reduces the severity of the illness. There is good evidence to show that if you're vaccinated, you're less likely to suffer from a severe complication of the flu. Likewise, in vulnerable people, there is good evidence to suggest that they get less hospitalized, particularly people who live in care homes or in sheltered accommodation. It's really vital for those people. So it's about exercising caution if you have symptoms to avoid family gathering as well.
Thank you, Dinesh. And finally, here's a look at some other exciting things that have been happening around the Trust this month. Well, that's it for this month's update, and I look forward to sharing more stories from the Trust with you next month. Don't forget, all our latest news and updates can be found on our social media channels, X, LinkedIn, Facebook and Instagram.